talked, Dr. Dale, about truth, integrity, and patience. I really like that. And you talked about how this movement can grow exponentially over time. What, in your own entrepreneurial journey, was there a time when you thought, well, maybe I need to put on the brakes a little bit because, a lot of times businesses fail because they move too fast. So where have you had to maybe accept that I need to have some patience in my journey?
We've always felt that we would welcome the opportunity to have to put on the brakes. And I've never yet seen a context where I felt that was needed or appropriate. The patience is more on the flip side of that. When I started, and I'd like to be the first to acknowledge I'm part of a group called C12, which is a group of sort of business roundtables around the country. If C12 hadn't stepped up to the plate and said, we love the idea of what you're trying to do, we're going to let you message all of our member companies, that's 2,000 member companies. And I sent out a short, maybe 8-minute video explaining what we're trying to do. Now, let me come to the truth and integrity bit. It'll explain the patience. What I said in this video is any of you who are willing to risk this with us have to be crazy. That's not normally how you try and persuade CEOs to join you. But I was just being honest. I mean, when you think within this insurance type sphere, it's ruled by the law of large numbers. And if you don't have thousands and thousands of people on a program, it's really difficult to have enough people to share the medical costs. So I wanted to warn them. They needed to be on a mission, like we were on a mission, because they were risking their reputation. They were taking a risk with their employees' health care coverage and provision. And this could come back to bite them. Only 3 companies out of 2,000 reached back out to us and said, we're prepared to take that risk. And thank God for those 3. We started in a completely untenable economic position. I don't know how else to describe it. Now, again, I apologize. You sort of have to take me the way I come. I don't know what you would have done in that situation. I did 2 things. I prayed. There's a story in the Bible about the children of Israel, and it says when they left Egypt, that for 40 years as they wandered around the wilderness, that their shoes didn't wear out and the clothes didn't fall off their back. And whether you take that literally or not, that falls in your court. I just said, Lord, in principle, that's what we need to happen. We need people to have no medical bills that need to be shared until we have something that we can pay it with. Now that's not all I did. I also took every penny that I had, and I approached one of our other board members who also had about the same number of pennies, and I said, we need to put all this money to one side, and if there's any massive sort of bill the first year, we have to have the money there to pay it, because otherwise we completely lose credibility. Well, 2 things happened. In our first 7 months, we didn't have one person submit a medical need, not one. So every penny that was given towards the medical cost sharing was able to accumulate to be available for when the needs began. And I guess we've been functioning at this stage 5.5 years, so that's a little over 60 months. I think in let's call it about 57 of the 60 months, we've had more money come in than we've had money that needs to go out. So, over those times, that's built up, not reserves. We're not allowed reserves. I'm talking in a regulatory world. We're not allowed reserves, but all hell breaks loose from the regulatory point of view if we don't have enough money to pay the bills. I mean, this is economic insanity. But what we have been able to do is to regulate what we have available within very clearly defined limits, where the regulators have been happy that we're being mature and responsible, but that we're not building up reserves. As I look at what happens, I think integrity is essential when you are building for the long term. That's why I still, to this day, I thank companies for their willingness to take a risk with us in a new approach. I don't want them blinded. We're not almost like insurance. We're not insurance, period. And we're super clear about that. Oh, and we don't pay the bills for you. No, you're cash payers. This is a completely new way. So we don't fudge it. We actually don't even provide people with a card that they can use, because we don't want the hospitals to think that we're insurance. We're not trying to make it look as close so that the people can slip through the gate. No, we tell the truth. Okay, and then we live out exactly what we've said. So the patience becomes necessary, because when you're doing that, you're not expecting that you're going to grow explosively. Now, some people would say we grow explosively. We've been very blessed, and recently we're named onto the Inc. 5000, and various things like this, which is exciting. But no, actually, if you look in this space, there are other companies that have grown much faster than us. And they've been, not all of them, but the ones that are really, not the ones with the 30-year history, not the Christian ministries, so please don't get me wrong, but the new pseudo-Christian ministries that have found a way to slip in under, you'd have to understand the Affordable Care Act and the 1999 provision and stuff. The whole idea was that there would be no new ministries. Actually, there have been a bunch of new ministries that have found a way to slip in under it, and some of them have been super unethical. They've had explosive growth, and as fast as they've grown, even faster they've fallen, because they're not building for the long term. So that's really what I'm describing.
Yeah, where I was thinking the connection there between the truth, integrity, and patience is that I think a lot of people, a lot of entrepreneurs, especially in our industry, are, because they're losing patience, are sacrificing the truth and integrity.
Yeah.
Dr. Smith, you want to have anything to add to that, or?
I'm going to tell a story that I don't think Steve and I have ever told about what made me think about it was your first 2 months not having any 7 months not having any claims, and just that initial time of uncertainty of the entrepreneur. It's that time is your enemy in the very beginning for certain. That's when I know we were most nervous. But what even many of the partners at the Surgery Center of Oklahoma don't know are the mechanics of how the facility was actually purchased. So Steve and I were on a hunting trip, and we wound up talking to some guys that were part of the company that owned the Surgery Center of Oklahoma at the time. And I'd made several passes just trying to figure out who do I talk to get this purchased. And we wind up on a hunting trip, and there was an ice storm, and so we couldn't even hunt. So we were just all pigeonholed in this lodge, and we got to talking to them, and the Surgery Center of Oklahoma at the time was failing. We knew it was failing, and thought, well, who wouldn't want to sell, something like this? Well, we came to terms, and we realized there was a general partner and there was a limited partner. Well, the general partner had about 80%, actually 88%, and the limited partner had 12%. So we made an offer, a contingent offer, to buy the general partner, assuming we could get the limited partner on board. And the general partner said no contingent sales. So I'll never forget it. Steve and I were at Chili's in Edmond, and we were sitting across the table. We each had a cold beer, looking at each other, and we had told the surgeons who were going to enter this venture with us that we were going to own 100% of this facility. They were part of other facilities where they owned 100% of the operation. And so Steve and I decided to buy the general partner, not knowing if we could get control of the limited partner. It turned out that we did, and that's a whole different story. I'm not sure I'll tell all the details on that, how that happened. But that uncertainty was definitely there. There was the more I look back at that, the more I realized how missional really we were. This was not about, if we do this, we can get rich. It was truly, looking back at the risks that we took to purchase that facility and turn it into what it's become. It really, looking back, I think it's even more clearly missional than we had any idea that it was. And I think that's why when you asked me the other day, what were you thinking when you did this? It's not even clear to me now. Looking back, it's becoming more clear. But the risks that we took to do this back then were just like you. I mean, you didn't have, you started this not knowing if you had the money to pay, the first bills that come in. And so it had to be missional. You couldn't have done it not driven in that way.
100% true.
Yeah.
Any questions out here? Going once? Okay. Gail?
I wonder if you would both say a little bit more about individual patients that are self-pay versus employees. Dr. Dale, you talked a little bit about, focusing on employers. And so I'm just curious, from both of your perspectives, for the services that you offer, is there a big difference in, marketing or taking care of people, whether they're individual self-pay people versus employees of an employer that you work with?
You want me to start? The difference in the way we deal with individuals versus the beneficiaries of self-funded plans is the individuals pay at the time the service is rendered. That's the only difference. If someone is a beneficiary of a self-funded plan, we have a handshake agreement that is 30 days, same as cash, and we send an invoice and they pay it. When it comes to marketing, the only marketing we really do are videos or blogs that I put out on Facebook or Twitter, which have been remarkably effective, I would argue. That's really the only marketing that we've done. All of the marketing, I would argue, that we do is aimed at individuals. I think that my attempts to market towards self-funded companies have largely been a failure. It's like pushing on a string. I think the employer have to be almost angry and enraged and realize the extent to which they've been lied to in order for them to enter this space. The group that we target, I think, with our marketing are those we think who have sticker shock. There are a remarkable number of people in the United States that, for all their complaining about how expensive healthcare is, they don't really care. There are a lot of people that really don't care what it costs because they're not paying for it. So our focus is on the folks who have that sticker shock. The gorilla in the marketplace is the self-funded employer. Half of the claims, I think this is still true, half the claims paid in this country are paid by self-funded plans. And that is such a gorilla that if that buyer wakes up really and truly wakes up and begins to buy in a transparent, cash, competitive market, everyone's boat will float higher. The individuals who are not part of a self-funded plan, that are either completely uninsured or part of a cost-sharing program, they will all benefit from the drastic reduction in pricing and the soaring of quality that happens when that gorilla wakes up and decides they're going to buy in a responsible way, as they should, and then facilities like mine will be completely full, and my competitors will have to change their ways and actually operate in the same way we do. So I see that tipping point is actually near, but it's the self-funded community as buyers that are going to bring affordability and quality to the actual individuals and everyone else. And that's how I see the sequence of events. I think Jay and I agree on that.
You said that you don't specifically market to the self-funded, or your outreach has not been as successful as you would like it to be, but you have many contracts. So how did those come about? Has that been a long-term organic growth to get to the number of, 300 or so
Yes.
employer contracts that you have?
Yeah, it's taken a lot of patience. A lot of the self-funded employers that we deal with come from third-party administrators that we work with. There are some employers we work with whose third-party administrator will not work with us for a host of reasons, so we just deal directly with that employer. But I found that if I reach out to the employer, I'm just the next guy trying to sell them something. You know, it's unsolicited and it's resented. The employer agreements we have are employers who have come to us, and I've met with one employer here in Oklahoma City twice, and I will not meet with them again, and because I was in that position where they were just treating me like a vendor, and what are you trying to sell us? And I think, oh my gosh, let me out of here. You really don't get it. Yeah. So when they come to us, it's different. They're already in the right mindset. If I go to them, I'm somebody trying to sell them something. It's kind of
you can't make a buyer willing.
Yeah, it's not a willing.
Right. It's not a willing mutual beneficial exchange. Dr. Dale, do you have anything to add to that? How you
Sure.
go with employers versus employees or individuals differently?
Yes, a couple of quick comments. We would certainly completely agree that these large self-funded plans have the greatest potential to bring transformation. And part of the lie, unfortunately, that most of the big plans live under is they think because they're self-funded that they're working in a normal economic environment. And they don't understand that their plans are mainly being administered, for the vast majority of them, by the BUCAs. That's Blue Cross Blue Shield, United, Cigna, Humana, whatever. Yeah, now, so when your plan is administered by these entities through the TPAs that they own and all of the, these types of structures, all it means is that the plan design is still functioning through the same system. So to give you one tiny little example, a large self-funded plan in Austin, won't mention any names because I don't have their permission, but they approached us about help because one of our staff were actually on their board. When we looked at their plan, which was administered, by one of the BUCAs, the plan design was paying them more money through these PPO discounts than the doctors were receiving for the services. And I mean, that's just one example. And we looked at the $7.5 million in their plan, and we cut a third off the cost just by altering the terms of the plan, which were egregious in the money that it paid. I mean, they were being robbed blind. So, and that wasn't even switching them to a different system, which, you know, is a longer term sort of process. So what I'm saying is, for people who don't understand what's going on in the system, it's hard for them to understand how the system is stacked against them. Typically, their trusted advisor, their TPA, their broker, whoever it might be, if they just followed the basic principle of follow the money, who pays the advisor? It's not them. And so the advisor works for the person who's trying to rob you of money. It's the wolf guarding the hen house. Anyway, that's just a comment. So historically, when we began, I formed Sadir in 2014. We didn't take our first clients until January 1st of 2015. We were absolutely right in the heart of the early days of the ACA. The individual mandate, if you remember, the penalty came in 2014. We could not find a way in 2014 under the ACA where we could protect the individual. And so we did not go for individuals at all. We only went for groups where, within an ERISA framework, we could have them have available something that would take care of, I don't want to bore you with details, but the individual mandate penalty was tied to preventative care, essentially. And so we found a way under the Affordable Care Act where we could legally help companies, not us, but someone else would help them to take care of the things that would take care of the penalty. But those things only cost 5% of total premium cost. And so we let the system take care for the 5% of what would take care of the penalty. And that freed up the 95% that companies would be spending for us to show them how they could save probably around 50% of the 95%. And so that's what we did. Now, until the individual mandate was rendered null and void, people need to understand it's not repealed yet, but it's rendered null and void by the tax penalty being removed. So when that was removed, we then began going for individuals. So in our early years, we only went to businesses, and we, not exclusively, but primarily went to small businesses because, again, you have to understand the way the penalty structures were structured. But for businesses of 49 and down, most of the second tier penalties that applied didn't apply to those businesses in the same way that they did to applicable large employers or companies of 50 and above. So we wanted to find legal ways to work within the system that didn't get people penalized while giving them access to what we were doing. Since then, we've found all sorts of ways, and one of the most recent things that has happened is that with President Trump's executive order that opened the way for the ICRA, which is an individual consumer health retirement reimbursement arrangement, there are also other ways where we've begun expanding quite significantly with medium and larger businesses. So, you know, this is regulation, where regulation basically impedes the progress of the free market. But thankfully, the Trump administration has been pretty effective at trying to find ways to decrease the amount of regulation, even if in doing that they're still trying to control things in other ways. So to the individual, we do market to them. That's not where our main experience is. Our main experience has been to companies, and we never go through HR. We always go to the decision makers. HR, I mean, it's the old saying about buying computers. You know, nobody in supply ever got fired for, you know, purchasing from IBM. And nobody ever gets fired in HR for just switching from Blue Cross to Humana or whatever. As long as you stay in the system, nobody's going to criticize you. But to move out of the system, you need the CEO. The CEO or sometimes the CFO or whatever. So we go right to the top. If we don't have the top, with the top, we start by explaining, we don't know if your broker is your friend or your enemy. Now, we know you think he's your friend, he's your uncle, he's, whatever. But we're just telling you up front, we don't know if he's actually your friend or your enemy. So we want you to understand up front that we're going to show you something completely different. And of course, run it by your broker or whatever. But when, not if, but when your broker says, but, let us come back and answer the buts. Because there will be lots of buts, but we'd like to butt heads with them. And where they understand that, that's worked really well. And so that's really been our approach. Maybe one other thing I should say, that when we work with employers, we still work with their employees as individuals, even though the company may be handling part of the cost. Okay, so the system has the company handling costs, although you need to understand for the vast majority of stuff, I mean, if you have a $5,000 deductible, you're to all intents and purposes uninsured. 19 out of 20 people are not going to pay $5,000 in a year. So they're spending all this money, and they still got out-of-pocket costs that are beyond. How many people in America have $5,000 in the bank that they can spend on a deductible? Maybe 5%, maybe 10%. I mean, it's tiny. So where the deductible, arrangement has gone under the ACA, the Affordable Care Act has made the vast majority of the country functionally uninsured. And I think what we're honestly most proud about what we do isn't what we save the employer, although that's obviously what we have to sell on, but is what we save the employee by dramatically changing their out-of-pocket costs. Okay, we transform life for the employee.
Excellent. Thanks so much. I think we're out of time, but we really appreciate everything you guys had to say today. Give these guys a round of applause.
Thank you again.